So we'll not see anything what's happening on YouTube, right? For us, it's only MST. Good morning, everyone. Welcome to HLP Community. HLP Community is an informal community of parents. We have come together to review, ancient culture, ancient practices, and ancient wisdom. It's an informal community of parents who have come together. Here, we have been discussing demanding needs that are there from the parents. We have done a lot of programs like fasting, weight loss, etc., etc. Let me introduce you to Dr. Vikas, who is a naturopathy practitioner. Dr. Vikas here is have been doing a lot of programs with us. He's been with the community for a while now. The programs he has handled for our community are fasting. We have gone different levels of fasting, right from fruit fasting, vegetable fasting, liquids, up to dry fasting. So there was one more flagship program that we kickstarted, which is weight loss. We have done PCOS, we have done diabetes, etc., etc. So today we have come up with one more very interesting topic, which is regarding liver. Liver is our body's natural detoxifier. Now, what if we have been cleansing our liver and flushing out toxins from liver and helping our body get the natural detoxification? I will hand it over to now Dr. Vikas. Vikas, it's all yours.
Good morning. Good morning, everyone, and thank you, Josna, for a beautiful introduction. So today we'll discuss about liver, which is a major, as Josna mentioned, it's a natural detoxifier and the largest detoxifier in human body. So to understand about liver, we need to know the structures, functions, and physiological effects, and how does it work, and what are the diseases associated with it, and what happens when the liver goes for toss. So the liver is a main organ in the human body where it starts its growth from third week of uh, embryogenesis. Embryogenesis means where a fusion of sperm and ovum takes place, and fetus is formed. From there, from third week it starts. Then till 32nd week, it is a major organ responsible for blood production and transportation in the fetus. So when liver is functioning well, you will be energetic, you will be glowing, the skin will be shining, and digestion will be proper, and it is also associated digestive organ which is responsible for breakdown of most of the food items what you take. Most means 95% of food items should digested with the association of liver. If liver functions on the lesser side, these things will never happen. So it is mainly found in the vertebrates. Vertebrates means those animals which have got backbone. Like any animal you take, you might be knowing the chicken liver, goat liver, etc., etc. So, in the same way, we human also have the same thing, which is the largest and heaviest organ which is found in we humans. So, this is responsible for digestion and growth of us, where the location of liver is in a tricky place. It is just located below your right rib, okay, and below the diaphragm, which is safeguarded by our ribs, and the one lobe, which we call the left lobe, can be accessible by 1 centimeter or two, not more than that. So what it does, uh, it stores the food. First, it stores the food, then produces the cell, then synthesizes the hormone. So it is a storing device, a producing device, and a synthesizing device. And it even produces the red blood cell, which is responsible for our growth. Until the 32nd week of your birth in your mother's fetus, liver is the sole thing which produces the blood cells. Then, even after birth, at least for 1 week or some 5 to 8 days is being noticed. So, till then, the liver is the sole thing which produces the blood cells. So, most of us might have undergone the jaundice, birth jaundice we call. At that time, liver gets a halt so that it gives its role to the human bone marrow. So bone marrow let it produce the blood cells. So at that time liver goes for a pause and the bone marrow produces the blood cells. At that time liver reduces its effect. So now coming to the basic. First we'll go for introduction. What liver does? Liver produces a digestive enzyme which is called as bile, and that is a fluid contains the enzyme which is called as cholesterol. Cholesterol which runs in human body continuously, and most of us will go to the doctor. My cholesterol is increased. What is the reason behind this? And the second thing is, you will feel a bitter taste in your throat or in your esophagus. That is what you feel is bile. When bile is produced and which is not been utilized by human body. So that is the bile. And in normal word, people will tell. pitta has been increased. That's nothing but the excessive bile secretion in human body. So bile also helps in breakdown of the fat. As when you talk about eyes, you need to mention about your nose also. With liver, there is one more smaller organ which is called as gallbladder. Gallbladder stores the bile inside it. The bile which is produced by liver is stored in gallbladder, and then it moves to your next digestion process. Where when you have your food, the bile from the gallbladder moves into your stomach. Sorry, it goes to your intestines. I'm sorry. The liver is made up of cells which we call it as hepatocytes and the Kupffer cells. And it will be amazed to know that liver is responsible for at least from around 300 to 600 uh, 600 metabolisms which is required, or the active functions which are happening in human body. So that is the basic role of liver. So what happens when liver goes for toss? Why the liver goes for toss? We'll go detail in this next.
Yes.
Hope you have got some ideas about how the liver works and why it is required, and what is the benefit of liver in human body.
Yes, doctor. That's pretty much clear that you have
And,
explained it.
and if there are any questions, please drop it down. We'll try to answer it later.
Definitely, doctor. I'll read out the questions.
Okay. So now we'll come to the structure of the liver. As I mentioned before, it is the longest and heaviest organ in human body. So no, don't take me for gender discrimination. Males are having on the higher side. The male liver will weigh approximately around 1.6 kgs, from 900 to 1.6 to 1.8. Whereas in female it goes from 700 to 1200 to 1400 grams. I'm sorry, it was grams in before, 1600 grams in males, and in females also 1.7 kgs, or 1400 to 1700 grams.
Okay.
Okay. So the blood supply of liver is mainly from, not required in detail, it is by portal vein and hepatic arteries. Now coming to the surfaces of liver. Liver has got 5 surfaces: front and posterior, anterior and inferior, and the upper. It has got 5 surfaces. So as it occupies the lot of spaces, so it goes with the surfaces. And now coming to the anatomy of the liver. Liver has got 2 lobes, the right and the left lobes. These lobes are connected. Right lobe is a bigger one, and the left lobe is a smaller one. And liver can grow its size at its will. If, as it's a storage organ, the moment you put extra load into it, it enhances its size.
Okay. Something like elastic, right?
Yeah. You can. It is not elastic, but once it grows, it will not come back.
Okay. Okay.
Elastic
Okay.
means
It will
it should
come
come
back.
back to
Yes.
normal size. But once it grows, it will never come back. That is
Okay.
done. You can
Okay.
maintain it till some extent. So maybe in case of the cirrhosis of liver, no chance, where liver size get enhanced. And in fatty liver, grade 1, grade 2, grade 3, the stages are common nowadays, where the size has been increased, but functions can be normal. In cirrhosis, no, functions cannot be normal. So, sorry, that's how it works. The liver's thing. And now coming to the uh, functions of liver. Let's come into the functions of liver. What are the functions of liver? Liver stores the food what we have taken. I'll come to this deeper. First, we'll go for the function. Liver stores the glucose, and in In other words, it stores what you have eaten. So, and liver is responsible, as I mentioned before, fetal blood supply. And next, the third, liver is responsible for breakdown of amino acids, carbohydrates, proteins, fats, etc. Anything. Liver is solely responsible and stores what alcohol we have taken in any form. I don't mean directly you take or with the medicinally you take. It stores it, so it enhances its size. Then liver is also responsible for production of blood cells, and liver also helps in the synthesis of certain things, and liver is also responsible production of certain hormones. Now coming into the first feature, which is called as glucogenesis.
Glucose, yes.
Glucose, where how it stores glucose. For example, okay, uh, in the human body, the moment we eat food, it gets digested, it gets absorbed, and it gets stored in three places. The first place where it is stored is in liver. That is called as liver glycogen. Glycogen is nothing but the energy. So, which is stored in liver is liver glycogen. But liver storage is small. The extra glucose, what is being secreted, that is stored in the muscles.
Okay.
When the muscles are also full, if you have eaten more, the next remaining thing should go to the fat.
Okay.
That is goes into the fat layer. I mean to say adipose. I'm sorry, adipose goes into the adipose. How does it get so? First, the liver storage has to be utilized. Second will be muscle. Third will be the adipose.
Adipose.
The last adipose is utilized. Very simple. You go to a restaurant, you eat. First, you will use your cash. But once your cash gets over, you will use your wallet. When the wallet also gets over, then you should go to your fixed deposits.
Correct.
That is the adipose is fixed deposit. The wallet is your muscle glycogen, but cash is your liver glycogen.
Liver.
Okay, that has to be utilized first. But when you load your liver with the other extra detoxificants, then the liver storage reduces. This is the basic physiology for all diseases. When liver storage reduces, if that the place is occupied with some other things, like your in detoxificants, you know, I cannot pinpoint this is what this is what this is what. So that will lead to the other questions later. I won't eat this. This will happen, so not required. So that storage reduces, then the body doesn't store anything in liver.
Okay.
But liver has to store something. It cannot leave that place empty. It will store whatever it doesn't want.
Okay.
Okay. Now, liver also requires 20% of total oxygen inhalation you do.
Okay.
Whatever oxygen you inhale, that the liver requires that because of its vast function.
Okay.
Okay. And then liver has got one more feature that it can, if your half liver is cut, it can go into full.
Yes.
Even if your just 20% liver remains, it can make into a full, not maybe with the shape, but with the size and function, it accumulates till there.
Okay.
And liver is one of the major autoregulatory organ found in human body. Autoregulatory organs which are like brain, heart, liver, kidney and spleen. For example, if some damage happens to this, the body will go into halt. Like patient will go to coma if the liver function is hampered, so that the load reduces. But if blood supply to the liver will receive in a proper way, the other parts blood supply will reduce. Liver will get its own. This is about glucogenesis. Then the bile secretion. Bile, as I mentioned, I briefed in first, it's a yellowish liquid which is secreted by liver and stored in gallbladder. Then where it goes to your stomach or into stomach and intestine, where it mixes with the hydrochloric acid and the pancreatic juice and other digestive enzyme, and which is a help in breakdown of fat and proteins. Then synthesis, the third one. So synthesis is, I mentioned about how it breaks down the carbohydrate and where it breaks down also the amino acids. The amino acids means proteins like lipase, amylase, then methionine, lysine, etc. Liver secrete one more thing which is called as a coagulation factor. What is coagulation? Coagulation means nothing but clotting. The clotting factor, there are 13 clotting factors are present in human body. From 5 to 13, out of all the coagulation factors are secreted by liver. If you are having a cut, it is not clotting properly, which means the coagulation factors are not secreted well, which means liver is the reason.
Okay.
Then coming into the production of red blood cells. The liver is, as I mentioned, see, I will be using this word so many times. Storage, expansion. The liver can store itself into the a bigger size. Liver can expand itself into the bigger size. So it stores and produces blood cells. The storage of blood cells for requires approximately around 500 ml of blood stored in liver for emergency purpose. Okay, and liver is, as now coming into the main thing which we have mentioned. Liver is a detoxifier, the biggest detoxifier of human body. As in a simple word, it is a drainage system of human body. Whatever comes, it will drain, it will come to liver, it filters it, it drains it, and sends directly into the kidney.
Yeah, to call it in layman terms.
Yes, directly sends it to the kidney. And I forgot to mention one thing here. Initially, I should have told. Sorry. The liver has got two drainages. Okay, it is the only organ which has got two. One which directly connects to the heart, where it is superior vena cava. So the superior vena cava goes into the right right atrium. From there, it goes into the lungs, and the carbon dioxide is thrown out. And second thing, it throws the things into the kidney directly. As it is directly connected down, it sends into the kidney. So you might have seen in your home building walls, etc., where pipes are connected to each other and it drains into one system and goes down. In the same way, your body's all drainage streams are connected into your liver. From there only it has to go down.
Okay.
Whatever things you do, it will come and get trapped in liver, and then it has to go out. That is the liver's function. So then it secretes one more hormone. I'm not remembering the name properly. Uh, Angiostensin. Angiostensin is responsible for raising your blood pressure up. So even if your BP is going up, also going up, not down, not down. If it is going down, means the responsible organ is kidney. It is going up, means it is always liver. Means your liver has gone for toss, or not. The function has been hampered. So, and liver also produces some enzyme to break down the hydrogen peroxide and fluoride, which enters to your body by any mistake or any chance.
Okay.
Okay. So these are the functions of liver. As there is lot of function, even diseases also should be on the higher side. But before understanding the diseases, we'll check for the symptoms. When you should give attention to your liver if you feel it's going down. First, the pale stools. The pale stools, which means the bilirubin, which is one of the enzymes secreted from liver, which cannot be absorbed by human body again, which is coming with the intestine, which enters to intestine and thrown out from your stools. That is produced in liver. Second thing is dark urine. When your urine color changes, in spite of having a lot of water, there are many other reasons why your liver can be on the darker side. Even with having lot of water, if the color of urine remains dark throughout, which means liver function is hampered. We normally suspect the kidneys might have been the reason, but it is not. Liver function is been hampered. Third is jaundice, which everybody knows. Jaundice, hepatitis. Jaundice is a symptom which is seen in all diseases. Let's not go to the diseases. Let us go into the symptoms. Then you can see swelling in your abdomen. If especially in this part, then you can see swelling in your ankle. Ankle joint, if you see swelling, which is also responsible for the liver is also responsible for this, which means liver is not able to break albumin. I guess albumin, yes.
Which is again a protein, right?
Exactly. Where liver is not able to break it down. Okay. Then the pain in your upper right quadrant, that is below your right rib, where you can see this.
Okay.
So, what happens? What are the diseases associated with liver now? I'll not go very deep into this. The diseases you should leave it to doctor. Let him or let her diagnose it. But the diseases are responsible for now. Don't take me wrong. If you take 10 people for a scan, 7 will have got the fatty liver for sure.
Okay.
The moment you see fatty liver, you feel liver has increased its size. For surely yes. But we always get confused with either cirrhosis of liver or hepatomegaly. These are different terms. With fatty liver, your liver can function well, but you have to maintain that. Okay. If you climb the next step, you will reach to the next levels of diseases.
Okay, there are different grades there, right?
Yes. 0, 1, 2, 3, 4. There are many. Okay. Yeah. So the major diseases associated with liver are hepatitis. Then you can check for cirrhosis, hepatomegaly. Then the jaundice is one of the symptoms. Then the excessive liver damage might even lead to your kidney failure. It leads, as liver is associated with the 500 bodily function, it has associated with many diseases too.
Okay.
So, diagnosis of the liver is normally made by, first is lipid profile test, which gives you the basic identification of how is your liver function. Then second is urine culture. The regular urine culture will give you the symptomatic identification which I have told you, like pale stools, dark urine, etc., etc. What are the treatments? Now coming into our point. First, let me discuss about the modern treatment methods, how the allopathy or other Ayurveda, other systems do. There are some medicines which will be given to control it, and even in allopathy there is no medicine to regenerate it. They go for Live 52 or like Himalayas medicine. They are the one which goes for it. Okay, and liver donation. liver donation, like you will transplant the liver, one person's liver to the other. As I have mentioned before, just 25% to 30% of liver can regenerate into a whole thing. Okay, those who have donated and those who have got a new liver, both will be come into the normal shape. Now, sorry, give me a second. Excuse me, I'm sorry.
No problem, doctor.
Yeah. Now coming into the treatment part. What are the uh, things which can help your liver to detox? Okay. Now, coming into the physical exercises, especially the cycling. Cycling. Maybe in my previous talks, I always emphasize on walking, but for liver, cycling is required. The first thing is cycling, and second, there are a few yoga postures which can maintain or regulate your liver function. Okay. Then the water consumption. Water consumption ratio remains the same. Your weight in kgs, for example, if a person is around 70 kgs, divided by 2, that will come to 35, add a decimal, 3.5. 3.5 liter is physiologically required. You can go +1 or -1. +1 in summer, -1 in winter. So you can go 500 here and there. Plus that is manageable. That much water consumption is required for a normal human bodily function. Okay, you can roughly guess you are around 70 kgs. Means not you, Josna, I'm sorry. If a person
No problem, doctor.
around 70 kgs, so he will be having somewhere around 4 to 6 liters of blood running in his body. So liver is a main. What happens when your bathroom is clogged? You have to put extra water. The same
To
concept
flush
like
it out.
the same concept like it. Then the food items. What you want to take? Do not take more than 1,300 to 1,500 calories. Okay, unless you are an athlete. Second thing, do not take oil fried or fat rich food. Okay. And do not take alcohol continuously, regularly. Okay. Which means you can, there are some limitations, no need to talk on this one. You can consult me personally. Then coming into the sweets, reduce sweet intake as much as you can. Then do not eat in intervals. This lies good for all the cases. What what if your liver has already gone for some changes? What to do? The best treatment here is sugarcane juice, barley water. Okay, and there is one herb which is very good for liver. We'll call it as bhumi amalaki. You can call it even. So you normally in
Which is
Kannada,
Nelanalli, right?
yeah,
In
in
Kannada.
Kannada it is Nelanelli. In
Yes.
Malayalam it is called as Kiranelli. So you
Okay.
will
Yes.
of course. Even gooseberry. Gooseberry is very good. Amla, very good for liver. And then I think I have mentioned sugarcane. Then coming into this vegetables. Okay. And cruciferous vegetables or tubers are very good for liver. Tubers and cruciferous vegetables are very good for liver. Then uh, then coming into the juices. When we coming into juices, a mix of two greens, any greens which you choose,
Any greens. Okay.
any greens you choose, because most one green will give you excess potassium to your body, so mix them always, so which balances.
Okay.
These are the basic things required to take care of your liver. But if you want to maintain the normal function in a day, it will never happen. So if you want to include some things in your regular diet, add few nuts in your diet every day. Add few nuts, and do not consume the food which is in excessive quantity, more than what your body requires. So these are the basic requirement for maintaining a healthy liver, or to get to the regeneration part of some part of liver. So your liver has not gone to toss in a day or two. It has taken long time, which means even correction needs some time.
Yes.
There should be a healthy lifestyle. Today you go and take us. You might even yeah. I forgot to mention one thing. This beetle leaves, they are also very good in case of jaundice and liver regeneration. Which means every day you go and take with pan or some supari. No, there is a rule to take it. When to take it, how to take it. Same sugar cane juice is good for liver, which doesn't mean that you might have heard in ancient times for jaundice, the patya used to be only sugarcane juice. How much ever severe jaundice is or hepatitis is, sugarcane used to cure that. Which means nowadays you cannot go and take all 3 times sugarcane juice. No, there is a rule. How much, how many ml is required for 1 week? That's how it goes. Okay. So adopt healthy lifestyle, sleep well. So this is what is going to maintain the liver. Okay. For brief in liver, and I think I have gone deep. I said 30 minutes. We are into 45 minutes.
That's okay, doctor. No problem.
Thank you. Thank you everyone for listening to me so patiently. If there are any questions, let's see.
Sure, doctor. That was a very wonderful, eye-opening session that you gave about, such a important organ in our body. There were really few facts, that we really never, pondered upon. It was very nice. Now we will, before opening up the forum for Q&A, I would just take a moment to talk about our HRP WhatsApp community. As I told before, that we are an informal group of community parents who are working tirelessly to bring to the world, to bring to the light our ancient wisdom, culture, and practices. So please, people who are outside of our WhatsApp community who are watching it today live, please join our WhatsApp community. And this is a prelude to the 5-day liver detoxification program that we are taking up under the guidance of Dr. Vikas. The links for which is flashed below. Please enroll for the detoxification program. And if you are not our WhatsApp community member, please do join our WhatsApp community member to get more details about this and much more programs of this sort. Now, can we just go ahead for the Q&A, doctor?
Yes, sure, please.
Yeah, I'll read out the first question. It says, tell us about the Liver Detox program. What will we do in the program? Like they want to know what is, the course of the program.
Okay. In this program, what we will do, first we will we'll assess the condition. There are, for liver, the detoxification goes from liquid, solids, and will go for sometimes even irregular food also.
Okay.
Now, the in program will give them for around 5 days, 5 days program to 7 days program. We'll look into this. Here we'll give them into raw juices and fresh fruits and the new and we'll give them some. There's no fasting for sure.
Okay, my next question was that actually.
Yeah, there is no fasting for sure.
This is
And
with the regular food, right?
Regular food. Will not put them anybody in fasting here.
Okay.
Okay. So we'll assess them first. We'll assess them, but as the liver functions are similar, so there should not be any trouble for. See, it's like you have to implicate in your daily routine, not in a day or two. See, uh, diabetes we can reverse. Somebody listens to us. Yeah, but liver is not like that. Liver, they have to follow. Even one day you do it, within a day or two, liver will change its shape. There's some very easiest things. We will not tell them go and do this is what is this available in forest. Go and get it. No. Either one amla juice, which is available everywhere. In some cases, where those who doesn't have diabetes will ask them to go for sugar cane juice or direct sugar cane. However, they are comfortable. This is how we go.
Okay, doctor. Let me move on to the next question. It is something like this. Increase in cholesterol level is due to not functioning of liver properly. Maybe he's trying to ask, is the increased cholesterol due to
excessive
liver
functioning of liver? It's an excessive functioning of liver, not because
it's the other way around from the patient.
Exactly. So liver is functioning on its higher side, so you have to slow it down. You're riding your vehicle in 160, 180, you have to come down to 80, 90. That is how.
Next question is, gallstone issue is related to liver. Can it be cured by liver detox?
No, it cannot be cured. It cannot be cured. Yes, gallbladder I have mentioned in the smallest way. I should have got it there. The gallbladder is a smallest organ which is associated with liver, where it stores the bile. If the bile is not moving to the next stage, it forms the stones. But there are some regulations here. I can answer this question. It cannot be cured, but it can be maintained. Please avoid the food which forms sodium bicarbonate and calcium carbonates, where the dairies have gone off. First, you should avoid dairies.
Okay.
Which will form the calcium. Please thoroughly wash your vegetables or whatever food items you take, so that sodium content reduces.
Okay.
So, sodium bicarbonate salts also should not be gone inside the body.
Okay. So we'll move to the next question. My mother has gallbladder stones, but it's moving. Could you tell natural remedies for dissolving gallstones? I think you have.
It will not dissolve. It will not dissolve. There are many things in theories, but I haven't seen any changes in gallstones. Because once stone is formed, it should come out. In kidneys, what happens? Once the stone is formed, there is no permeable membrane. It is thrown out directly. But in gallbladder, when it's formed, there is a semi-permeable membrane, so which allows the liquid to go out. Okay, so there might be, rarely there are some, if stones are dissolved, which means that was not stone. You might see, the stone has dissolved, that is not stone. That is nothing but the soluble bile, which is just forming in the form of all together mass, then it dissolves.
Okay.
Yes.
Okay then. Okay, we'll move to the next question. Any remedies for bad smell in urine?
No, no, it's like you need to go for a urine culture. Bad smell comes in only two reasons. The first is when there's bacterial infection, then the bad smell might come. Or else try drinking barley water, ashgar juice, and sufficient water intake. As I
Okay.
have said,
Can that be taken on a daily basis, doctor?
yeah, see, barley water should be taken when it is hot.
Okay.
Okay, and if that example, I'll take this any remedies for bad smell in urine. I take his weight around 80 kgs. So 150 ml of barley water can be taken every day. Especially take it in the first half, as it is diuretic. It's a diuretic. It flushes out everything. So better to be
Okay.
taken it in the first half, or else whole night that person will be going to the washroom.
Okay. Okay, doctor. Okay. So next question is, can the fatty liver be reversed by regular liver detox?
If it is in grade 1, 100% yes. This crosses grade 2, then goes with the luck. Am I audible? Am I audible? Hello? Am I audible, Josna? Okay. Hello? Josna, you are not audible. No, Josna, you are not audible. No, Josna, there is some issue with your.
Okay. Let me move to the next question. Okay, we have the next question here. Gallstones can be removed with Epsom salt plus olive oil with orange juice. Is it so?
I'm not sure. I'm not sure. Which I'm not sure. I cannot answer.
Okay.
Sorry. I'm sorry.
Okay, doctor. No problem.
I have tried this with two patients, but I'm going with lemon juice, not orange. As lemon is also a best detoxifier. It hasn't
Okay.
worked. In fact, the patient was getting the stone formation on his head because liver was throwing out the Epsom salt itself.
Okay.
So I'm not sure. Maybe the
Okay.
treatment what I have done might be only because it's orange juice. And with two patients cannot be taken as research, right?
Correct. Correct. Uh, 1 second. As you said, we have to take barley water, right? The question is, do we need to wash barley?
Washing is required, but soaking is must.
Okay.
So
How many hours would we need to soak that?
for example, I'll take example of this. You have been given barley at 11 a.m.
Mm-hmm.
Like, you have given at 11 a.m. Soak barley at 8:30 to 9 morning,
Okay.
2 hours
Okay.
before.
Okay.
Boil it well at 10:45 or 10:50.
Okay.
Then 11 a.m. Filter it when it is hot and drink when it is hot or warm. You can add the if you would like to add, you can add a pinch of pink salt or whatever.
Okay. So, is there any guidance for the amount of water that you take? The ratio of barley and water. Is there
Yeah,
any
it is.
guidance on that?
It is like 300 ml. 1 tablespoon of barley can be soaked.
Okay, doctor. Okay.
If 150 ml is given to drink, then you should soak 1.5 teaspoon, not tablespoon, 1.5 teaspoon. You have to soak it in 220 to 225 ml of water. When you boil, the extract will go off. Even barley will also suck some water.
Okay, doctor. Okay. So, next question is, what all will be the symptoms that one person's liver isn't healthy? I mean, maybe, And second part of that question is, apart from that, what you mentioned, bitter taste in mouth. Maybe he's asking you what you mentioned about the pitta, right? Apart from that, he's asking for the symptoms of ill health in liver.
Skin itching.
Okay.
The first is continuous skin itching, and the black patches or pigmentation in human body.
Mm-hmm.
Then especially itching in ankles and heels. Okay. Yellowish discoloration of eyes.
Okay.
Dark urine color is seen.
Mm-hmm.
Okay. And on pitta can be as a sorry bile. I should mention it as bile. When you feel bitter taste in your throat, you see even the migraine is also responsible because of excessive liver function.
Mm-hmm.
Okay. So these are the basic symptoms where you can notice.
Okay. Sure. Next question is regarding liver detox program. Will you be advising specific diet based on body conditions?
Will assess according to the condition of liver, and second is a body condition.
Okay. Okay, doctor. Okay. Let me give it a minute if there are any questions. Okay, can these detoxes be done by nursing mothers? Yes, I think we had to address this.
Good question. Very good question. See, there are few cases where we need to avoid or we need to avoid this liver detox where there is a cirrhosis of liver, where hepatitis B is already present. Hepatitis B cases are present. Okay, in these cases we need to avoid even the little bit of trigger for the liver function. Then we will come to know we cannot give it. And in nursing mothers, until the baby is solely on breast milk, then better not to go for it. If the baby is in solids and breast milk, yes, we can go for it.
Okay. I will add one more question, regarding that. How about pregnant mothers then?
No,
how about pregnant mothers?
Better not to. Better not to.
Okay. Okay. Next question is, how will you know the condition of the liver? Is there any test for that?
Okay. See, the basic tests are lipid profile. The basic tests required are the lipid profile test, where it will show you. See, the classically we'll go for lipid profile where your body total cholesterol, triglycerides, if they are in normal condition, we'll no need to go for any other tests. If
Okay.
cholesterol is on the higher side, your liver is functioning more than its normal function. So we need to slow it down. Very simple. If it's on the lower side, just shoot it up. Even though then the advanced test will come into the liver function. If the bilirubin or albumin is going out from the urine,
Mm-hmm.
which means liver is not able to process it, then the next test is required. But when you reach to that state, your body will show other symptoms. You will not wait till then. Your whole face will go to yellowish color, where the jaundice signs are required, where the jaundice symptoms are seen.
Okay.
So you cannot eat sufficient food, you will start vomiting. So within that, you would have done few tests for sure.
Okay. So is that LHS?
Hmm?
Is that LHS test what you're talking about? The advanced
Lipid
test?
profile,
Lipid profile test.
lipid
Okay.
profile and renal function.
Okay.
Lipid profile, renal function. These are the tests which are required.
Okay. So do we need to take these tests before we join this detox program? The participants?
If I personally trust my patients. Whatever they say, I believe it. Okay. So, if you do the test, well and good. I'll ask the detailed case history. The moment I get doubt, there is some issue, then I'll ask them to do the test. If they do the test in prior, well and good. Will be that will ease our thing if we have to go to
Correct.
it.
Correct.
And sometimes it's not like they will lie to us. They are not aware about it.
Maybe. Yes.
And they are not aware because they haven't undergone that studies or what is required. Every patient we take them, they are not aware. So the moment we get doubt, but only one thing, when we ask some questions or case sheets, please answer that promptly what you are undergoing with it. Even though there is few confusions, drop 2 to 3 answers so that we are sure.
Okay. Doctor, is my voice audible?
Yes, perfectly.
Okay, doctor. I'll take the next question. Can our liver detox our body from heavy metals like lead, aluminium?
No.
Okay. How frequently liver need to be detoxed? How will you know that liver needs detox other than medical tests?
Okay, good question. Observe your urine and stools regularly, at least once in 3 days.
Okay.
If your stool color changes, okay, or your urine color changes, that's a call.
Okay.
That's a call.
Okay, doctor. So, how frequently can we do the detox then? Like, how frequently can we repeat that?
I forgot. I'm sorry. You can do it. See, our human body, whole RBCs are regenerated in 86 to 90 days.
Mm-hmm.
Okay. So, taking 1 month advance from this, 4 to 6 months, you can do it once.
Okay, doctor. So, can these detox...
If you have done time properly.
Okay.
If you haven't done, you can do it regularly.
Okay, I'll take the next question. Can these detoxes be done while someone is taking medication?
Yes, well, these detoxes can be done when somebody is taking medication, and detoxes cannot be done if somebody is consuming alcohol.
Okay, major point then. How about... Okay.
And for a few days, when we are in detox program, the oil fried and non-vegetarian foods will avoid.
Okay. So for those 5 days, right?
Yeah.
Okay. How about kids? Is there any symptoms we should notice? Do they need detox? Maybe it's about the age limit.
Age. So, There are some cases where even from birth the liver is not functioning well, because in childhood if somebody gets jaundice attack on the severe side or hepatitis attack in the severe side, that time we need to take a call. If not, until 18 to 26 the liver will be stable normally.
Okay, so it is post 26 on a general note.
And until their mom is feeding them, normally liver will be perfect unless they can eat.
Correct. Okay. My mother face is very dark, black. Is it because liver not functioning properly? Any remedies for that?
Okay, maybe once the pigmentation starts, tough to go. See, we are not very sure. Black only in the face, even it happens because of sunburn or sunstrokes also, or tan also might be. So see the result. First you need to check for external application. Try applying turmeric. Turmeric, because of turmeric, if it is not going out, try amla juice. It will go off. It will not go off completely. There will be some marks, but at least by 60% it will come down.
Okay. Let me check if there are any more questions. Is liver transplantation possible? I think you spoke about this.
100% yes, if you get a perfect matching donor.
So match is that the blood group that we need to match?
There are a few other
Is
stuff.
that the match? There are a few other stuffs as well. Okay. Okay.
It's possible, but
it's possible. Fine.
Same like kidney. This is the only one. So see, the artificial livers are present, but your body doesn't accept them easily. 1,000 might get 60 to 70% success. That too rarest of the rare. But if you get a matching donor, it works.
Okay, doctor. I think we have come to end of QA session. Here I would like to, take this opportunity to thank you for this wonderful session. It was a very, indeed deep knowledge about physiology of liver, its functionality, diseases, and the way you detox it naturally and all of that. And Q&A as well was very informative. So I would like to ask everybody who are listening to join our program, 5-day liver detox program, to take maximum advantage. Dr. Vikas is here to help us, guide us, and give the customized recipe that's required for your own liver condition and body condition. Please do join us. The links are given below for the enrollment. And again, I would like to invite you all for our WhatsApp community. Please do join our community to take maximum advantage of information about ancient remedies, recipes, ancient ways of life, wisdom, spirituality, and things like that. So before signing off, Doctor, would you like to give any planned takeaway notes?
No, I have given in detail. I need to just thank everybody for listening to me for 1 hour on Sunday morning.
Okay, doctor. Okay. I would like to thank all of the admins and the technicians who are, working behind the screen to make this program happen. Thanks all. Thanks, doctor.
Take care.